My name's Ed Kassis. I'm a thoracic surgeon and I work for Genesis Healthcare system. My education in medicine started at the University of Pittsburgh, and after that I went on to do my general surgery training at the Johns Hopkins Hospital in Baltimore. Did 3 years of surgical research work at the National Cancer Institute, which is parts of the National Institutes of Health, and then went on to do a cardiothoracic fellowship at MD Anderson Cancer Center in Houston, Texas. What I love about being a doctor is several things. First is just being a surgeon is very rewarding. Being able to conduct a good operation, helping the patients through a difficult time, getting them out of the hospital with minimal complications, if any. But I think what's most rewarding is when I see the patients back after 5 years and I can tell them that they're cancer-free. The patients that I see in my practice primarily have cancers of the chest. I almost exclusively manage patients with lung cancer, esophagus cancer, chest wall tumors, and mediastinal masses. I do open surgery on occasion when it's indicated, but for the most part, my practice focuses on minimally invasive surgery and robotics. When I approach patients in the clinic, I understand that it's often a very challenging time for those patients. They come in quite overwhelmed, recently told that they were diagnosed with some type of cancer. And when they come into the office, they have a lot of questions. The nature of the diagnosis, what's the stage of their cancer, what's the treatment, how long are they going to live? And the challenging thing for me sometimes, or for any healthcare provider, is to provide them the information that they need in a way that's clear and concise and matter of fact, where they understand everything that they need to understand, but also doing it in a way that's empathetic. Because these patients really are going through a difficult time. And while this is another day at work for me, because I deal with lung cancer, esophagus cancer patients often, this is a life-changing day for them. And it's important that we as clinicians understand that. I have several memorable patients. There was one gentleman who was referred to me for esophageal cancer, and he was told by his oncologist that he had metastatic disease and was not a candidate for surgery. After I saw him and I worked him up, we determined that he did not have metastatic disease, and I ended up taking him to the operating room to do a robotic Ivor-Lewis esophagectomy. This was probably around 7 years ago now, and I just got a note from him that he just saw his granddaughter graduate from college. In June, I am doing an event called 29029, which is over a 36-hour period. We're going to climb 29,029 feet, which is the equivalent height of Mount Everest. So there's a mountain in Idaho, in Sun Valley, that we're going to hike up 15 times over the course of 36 hours to achieve that 29,029 feet elevation.